Okay. This lecture is going to be for the antibiotic section, or treating bacterial and non-bacterial infections. Um, Quiz 2 went very well. It was a little bit tougher, probably a lot tougher. Um, I've got a lot of feedback from some of you on at least two questions in particular that I can think of. There was one that had to do with fish oil and lopid. In fact, I had asked uh, which of the following would be best. The ticket there is that the fish oil was over the counter. And if you'll recall in my lecture, over the counter doses, you can't take enough of it. Lopid was the correct answer there. Now, hemoglobin A1C had nothing to do with the question. Just was a little bit of information as to why the patient might have some hypertriglyceridemia. And what I told one student in response, and everybody remember this, remember when we're taking the quiz, remember what topics we're actually studying. If you see information on a quiz that might be from possibly another chapter, for example, we were talking about hyperlipidemia, and I was talking about diabetes. Well, diabetes is a whole other chapter, so don't try to expand what's in the question to another topic that we have not discussed yet. Like I said, I'm not trying to be tricky. The question has all the information you need. So that one I'm standing firm on. But there's another one, and maybe another couple of two. Don't worry, I'm going to look over all of them and give credit. Some of you did have some extra answers that I felt were fine. I read the way that I wrote the question, or your reasoning for it was valid, then I'll give extra credit. I can't remember what they are, but I've got them written down. Anyways, the majority of you did very well. The class as a whole is doing very well. Sorry that there was no lecture for last week for the pain management and vaccinations. The topic this week, of course, is bacterial and non-bacterial infections. So here's what I'm thinking. This is the other, what I would call the other major quiz in terms of most difficult information in the amount of time that we have to take the quiz compared to the last one. So antibiotics are like the biggest thing. You're going to prescribe those every day, forever. No matter where you are, what you're doing, you'll be prescribing antibiotics for something. Now, antibiotics were very difficult they are very difficult for a lot of people to really get a handle on. There are a lot of them, a lot, and they are complicated. You can't just sling antibiotics out there like they, we're going to spray and pray or shoot first and ask question later. We need to know, what kind of infection we're treating. Does it require antibiotics? Which antibiotics are actually going to treat this? I will tell you this. Do not be afraid to have an antibiotic reference book in your lab coat all the time. Hold on, I got one right here. Oops. I carry the Sanford guide. Most infectious disease doctors have these. They tell me that they're very good, and they look really complicated at first, but actually they're pretty easy to read. It tells you, what kind of infection, which antibiotics are best, how to give them, and then a comment section, further information. That's a good one to have. Actually, you can get it for free from, I'm trying to remember who sent this to me. Cubist, C-U-B-I-S-T. That's a pharmaceutical company. Look them up and see if you can get a free copy. But find something simpler for now. The internet's full of all kinds of good things, and after a while you'll get really used to it. And also, let me tell you this: this is for real world application and not the perfect world examination. Real world, you'll get set in your own selection of antibiotics. You may treat patient A with these antibiotics. this person may treat patient A with these antibiotics. Well, guess what? They are both good choices. We have a lot of different antibiotics. And don't forget that just because it's new doesn't mean it's better. A lot of old school antibiotics work wonderful. Okay, so I think I started to say something and then I totally got off track. What I was going to say is about the upcoming quiz. Because this is so much information and antibiotics are so important, what I think I'm going to do is the actual quiz content is only going to cover the anti-infective section, bacterial and non-bacterial, and then the discussion board that goes along with. I think there's a discussion board coming up at probably about the time the test opens up. We'll make that one over pain management and vaccinations. Vaccinations. I don't do a lot of vaccinations in the hospital outside of the flu, pneumonia, shingles. Those are sorts of things that you review them. You need to know them. They may appear on the board's examination. Definitely need to know them for that. So I'll come up with, it's going to be a 2-question discussion board. The first part will be about pain management. The second part will be about vaccinations. Now, if anybody feels like they're getting underrated or not getting enough of an evaluation for that information, let me know. We'll come up with something later. Maybe we can do a semi-final examination on that material. But we've got so many weeks to cram in all of this important information, and I can't always rank them as this is important, this is not, because they really all are. But vaccinations and pain management, those things for now are the things you're going to do all the time, but for the sake of testing, we'll make it a Blackboard discussion for those, and then a quiz for the antimicrobials. If anybody really disagrees with that or doesn't like that or has a better idea, just let me know. You know that I'm open to things. It just seems like a good idea to me. Or if everyone would prefer, I'll just combine it all into one quiz, but it is going to be a longer quiz if I do that because of the antibiotics. So for now, we'll plan to do it like I've just said, but if enough of you protest or say you want it done this way or that way, we'll consider something else. Okay, so let's get down to business. The book, we're talking about chapter 17, which starts on page 309. Okay, here's the bad news. Read every page. This is one chapter that I can't tell you this page has better information than the rest. They all. Now, here's what I can tell you on how to study this chapter best. Is understand the drug class. I've said that a million times, and we'll say it again. When it says penicillins, understand penicillins. I don't care whether it's penicillin V, G, amoxicillin, piperacillin, all the cillins that are out there. Same thing with each class. Cephalosporins, macrolides, monobactams, all of these things. I'll tell you what, look on page 311, and I have marked something that is very good information. This will be on the quiz. Is the difference between bactericidal and bacteriostatic. As you all know from microbiology, bacteriostatic means it stops the production of the bacteria. They can no longer reproduce. Bactericidal, of course, kills those little boogers. And that's what we really want. Now, when treating patients, it's never going to be as easy as here's this bug, here's this antibiotic. In real life, they're going to have allergies, hypersensitivities, cost may be an issue, things like that. But remember, for this test, perfect world. Everybody has money, unless, and this is real important, in the question, unless I say they have an allergy or anything else, don't assume that it's there. What's in the question is what's there, okay? So, real world scenario, and perfect world scenario, bactericidal is the best when you can do it because it kills them. Okay, best chance of the infection not coming back. So read up on that, page 311. There's a nice diagram of a bacterial cell. I don't expect you to know about the anatomy of that, but basically what that anatomy does for you is describe many of the different ways that antibiotics work. Do they inhibit cell wall synthesis? Do they call cytolysis? How do they work? And you can see that on the top of page 312 in the upper left-hand corner. It talks about different ways that those work. Now, on the next several sections of page 312 to 313, read those. What I want you to take away, mainly probably for quiz purposes, is on 313 in the middle where it says empirical prescribing of antibiotics. Understand what that means. For example, you have a patient that comes to your office, they're sick, but they're not sick enough to go to the hospital. You're pretty sure they have pneumonia. So, but you're suspicious to the point that you want to draw blood cultures while you're there. So you draw the cultures. Well, obviously your patient's not going to sit in your office for 3 days waiting for those to grow, so you send them home. But you need to select an antibiotic. So empirical selection is you choose an antibiotic that studies have shown to work for this presentation. Your clinical experience shows that this works for this presentation. And then once you get the cultures back, or based on the patient's progression, you can narrow down your antibiotics. And many times you'll hit it right on the head off the bat once you really get into your practice. So know what it means to prescribe an empirical selection, okay? And antibiotic interactions are just about like Coumadin. They interact with a lot of things. A lot of people you're going to see in your practice, we're always talking about chronic disease, so a lot of people with atrial fibrillation, be careful. They're on medications that you cannot prescribe certain antibiotics with. Levaquin and amiodarone, or Levaquin and Sodol. The fluoroquinolones do not go well with a lot of antiarrhythmics, okay? Well, that's actually right here on this page. Quinolones and macrolides are the group of antibiotics most commonly associated with clinically significant drug interactions. So, sounds like a good question to me, but remember that. Now, on page 314, there's a table 17.1. It's talking about empirical treatments for methicillin-resistant Staphylococcus aureus. Now, in undergraduate school, they got us all worked up about MRSA and people on isolation as if they had a demon possession. We needed to get an old priest and a young priest in there, as well as some antibiotics. If there were any antibiotics that would work, mostly we just needed some priests. In my practice, I see MRSA all the time. And it's not that I take it lightly. It is an infection that can become very serious, but chances are we've all got it. A great majority of us do. And I always tell people, they say, "Oh, we come to the hospital, it's nasty, there's bugs." And I ask them if they shop at Walmart. And I tell them, spend the day in the hospital and look around. See how many times the floors are getting cleaned, the rooms are getting cleaned out. There's actually a lot of environmental service effort that goes into any hospital, but at Walmart, not so much. In other words, we're exposed to these things all the time, most of the time with not even knowing about it, whereas in the hospital, we actually have the advantage of no